Does your VA doctor have your back? I think this is a loaded question because it depends on the relationship with your VA doctor. If you've been engaged with them for 10 or 20 years, or even five, eventually they're going to get promoted, retire, you're going to get another one. So it really depends on the doctor that you currently have, and then what the relationship is like with the one that replaces that doctor. So I see three doctors at the VA right now. I only have a really good relationship with one of them, so I guess one out of three isn't bad. I wish the other two would embrace their jobs a little bit more. I mean, yeah, I'm a little bit of a pain in the ass, but still, I mean, they're the Veterans Health Administration. They're my treating doctors. So it'd be nice to have the same service from all of them. I just personally don't feel that way. When it comes to your VA doctor helping you with your VA disability claim, I think this is where the departure happens. And I definitely don't think VA doctors have your back when you're talking about veterans benefits. All your primary care doctor would need to do is check you up at your annual physical. If you're not getting your annual physical, you should be. And they should listen to you describe your symptoms, right? I mean, that's what they do anyway. They take notes. So they could literally listen to your symptoms. And if your symptoms are worse, they could go into your records and see what you're service connected for and what you're not service connected for. And if they see a secondary service connection link, or that one of your service connected items is worse, they could flag your file on the spot right there and take an extra 10 minutes to help you out. If they can't help you out, and this is like your primary care doctor, but they keep track of everything you're doing. Cognitive behavioral therapy, if you're seeing a VA psychiatrist or a VA psychologist, they could pass you over to the appropriate doctor to make this call for you. So they have the ability to either help you on the spot, or take a few minutes and get you over to the doctor that can. And by help, I mean, Combat Craig's diagnosis is reaffirmed and his symptoms are worse. They could actually use an internal use DBQ and just check off the boxes explaining how your symptoms are worse. And if you have a secondary service connection issue, they know what secondary service connections are. They're doctors. I talk about them. I'm learning about them. I've been doing this for a year. They're doctors. They know what secondaries are. They definitely know what they are once you get them service connected, right? So they could help and actually fill out everything and just do a internal use DBQ for you. And this would actually eliminate the need to even see a C&P examiner in the first place, because it would be a VHA doctor doing this. And then, of course, the flip side of that coin is if you get better, they would also have the option of reduction. But I think most veterans don't have that problem. Most reductions are because it's so frustrating to go to the VA, you just stop going, and then they assume that since you stop getting treatment, you're better. So that's not the case. But there would be two sides to this coin, I would think. So all doctors are very familiar with secondary service connections. They're familiar with DBQs. I mean, they're not hard. Like, you and I could fill these things out. They're check boxes. How many times is he prostrating? Is it weekly, monthly, every couple of months? I mean, it's simple stuff. And they could give you a diagnosis for a secondary service connection. And they could write a simple nexus letter linking your secondary service connection to your already service connected thing, and they could document the severity of your symptoms. Like, think about it. Not only are they able to do this, they're already writing notes in your medical records. And the VA raters are using those notes in your VA claim to a degree. I would argue how much those notes actually help, but this would actually put teeth into those notes if they reaffirmed the diagnosis, added in the nexus statement or the nexus letter, and documented the severity of your symptoms by filling out an internal use DBQ. Secretary Wilkie, if you are watching this, sir, please take this into consideration. If you really want to help veterans, get the treating physicians at the VHA involved in our benefits. They're currently separated. They're like two completely different organizations right now. Get them working together. That would actually help veterans, and it would make our lives so much easier. It would be less stressful. We wouldn't have to go use private doctors to tell our side of the story, right? You could reduce the amount of C&P exams by a lot. You could probably ditch all those contractors, and you would be using your own doctors at the VHA to write independent medical opinions. You'd have so much control over how this process works. I mean, this is it. This is the $1 million idea, $1 billion idea. You can make veterans happier, and you could save a ton of money in the process. This whole thing really should be easier, and if you're interested in checking out some easy VA disability claims to win, you could check up there, little cards popping out. And let's go ahead and take a look at a sample Nexus letter. I'm going to throw it on the screen here and show you how easy these things can possibly be. I mean, we're literally talking 10 to 15 minutes to check off the DBQ, reaffirm or make a new diagnosis, and then do the Nexus letter. I scratched out the guy's name a little bit. That's not the point. So this is how easy it could be, you know. This is my patient. I started to see him for arthritis in April 2020. I've examined him during his visits, and I've reviewed his VA records, including imaging and other private imaging records. In my professional opinion, patient has had underlying inflammatory spondyloarthritis affecting his axial spine joints. I suspect that it is least as likely as not. That's the Nexus statement itself. And then he puts in the tilde and 50%. That his shoulder pain worsened after his lumbar spine surgery. I see very similar shoulder pain complaints in patient after similar lumbar spine surgeries. And that's it. That is the Nexus statement. Like your VA doctor, whether it's your primary care, if they're capable of doing it, you know, if it's migraines or IBS or something like that, or getting you over to your VA psychologist if it's a mental health issue. And then if you really wanted to go a little farther, go to your chronic pain doctor that's giving you shots in your back. If you need to talk about, you know, orthopedic conditions or a podiatrist or something like that. But this is an example of what the VA doctors could do at the Veterans Health Administration. They could just put a simple little note like this. It would take them 10 minutes to bust something like this out. Again, I would say put the DBQ in there as well. So it's very clear what the severity of symptoms are. But this alone is a, you know, kind of an all-in-one. This is all the VA doctor would need to do. They could even simplify this whole process a little bit more if they really wanted to take a look at it and get the VHA involved with the VBA. Be sure to click the like button and the subscribe button, and leave a comment and let me know what you think of this wacky Combat Craig idea. I think it would be so much better for all of us, everybody involved, and it would save a ton of money having VHA doctors involved in our healthcare, actually, and our benefits. Check out this video here where I broke down some valuable VA disability claims. Check these out, and this video I go into depth for a few minutes, and I'd like you to take a look at this one, and I will see you in the next video.